everyone, and welcome to Prune Belly Insiders. I'm your host, Michael Adams, and today I got a special guest with me. Everybody, please welcome board-certified plastic surgeon, Elliot Duboys.
Good evening.
How are you doing today, Dr. Duboys?
I'm doing well.
So why don't you tell us a little bit about your background?
I don't know where to start.
Uh,
I'm a Long Island native. I've been a board certified plastic surgeon since 1984, working in the operating room since 1967. When I first encountered a case of prune belly during one of my rotations. I'm a professor of plastic surgery at Stony Brook University, and I'm in current practice in Huntington, New York.
That's amazing. So, how many prune belly patients have you worked on?
2.
All right, that's good. So, what was it like when you first got your first prune belly patient?
Well, my first prune belly patient, as I alluded to before, was seen at the nursery of Maimonides Hospital when I was rotating through pediatrics, and I was fascinated by the deformity. It's very rare. And my second prune belly was when I was working with Dr. Ralph Gurr, when we were doing total abdominal wall reconstructions. And Dr. Gurr, and I was his student, he was one of my senior mentors. I actually approached him. He had not heard of prune belly, but because of what I had seen, I guess it was probably in the early 70s, I said to him, we got to take this one step further and bring this into prune belly. So we went to a very active pediatric surgeon, Dr. Elizabeth Carrillis. Unfortunately, she's gone now, as is Dr. Gurr. And Dr. Carrillis had one patient in her practice that had prune belly that she was seeing. And I guess the rest is history. Then we contacted him, and he was our first surgical candidate. And he was the first prune belly that we operated on with our new procedure.
That's amazing. And are they still doing this procedure today, or how common is this procedure for prune belly in specifically?
Well, I really don't know. I've lost a lot of contact. There was a plastic surgeon in Texas. His name is Jeff Fearon, and I've spoken to Dr. Fearon on a couple of occasions. I guess, unfortunately, at my age right now, everybody's my junior. And he had done, I believe, about a dozen prune belly cases. He was at a major academic facility down in Texas.
All right. Can you explain the procedure a little bit?
Yeah, prune belly, as you know, has a triad of symptoms, and usually seen in males: undescended testicles, urethral valves, and I'm sorry, my phone, I should have shut that off.
No problem.
And lack of abdominal wall musculature. And we were basically, as a plastic surgeon, and Dr. Gurr was not a plastic surgeon, but he was very active in muscle transfers. In fact, he was the first person to describe muscle transposition for all different parts of the body. Oh, right. I'm sorry. I hope you can edit this.
It's no problem.
And basically, we found that a lot of the prune belly patients, other than having no or minimal abdominal wall, they couldn't cough. They were delayed in sitting up. They couldn't participate in sports. They had respiratory disease. They've had back issues and everything because there was no balancing muscles of the anterior abdominal wall with the back muscles. And you couldn't generate enough intra-abdominal pressure to cough, having problems with bowel movements because you couldn't generate problems. So I thought this was just an ideal situation where we can alleviate that And I think you know Frank
Yeah.
Walker. He was, I guess he was my guinea pig at the time. He was 11 years old at the time, and we're still friendly to this day. And we thought that we would take some muscles from his legs, muscles that were not necessarily used for walking, and then transfer those muscles to the abdominal wall. And when we were able to transfer the muscles and create an actively contracting muscles in contrast to the back muscles, I have a photo of Frank doing sit-ups, and that was literally unheard of prior to us having done this. And then we took it a little step further. We did a lot of research on this. We did EMGs, which is an electromyogram, where we put electrodes into the muscle, and we can see that the muscle is actively contracting, during sit-ups, with coughing, with bowel movements, and everything like that. And we published our first paper, I believe it was in the early 1980s. And this was a surgery done, I believe it was in 1981, if I recall correctly. And then we published our findings in a Journal of Experimental Physiology or Plastic Surgery. I really don't know where that was published. And it got picked up by a lot of people. And I guess that's the gist of the operation.
All right. And what are some of the side effects from the operation?
Well, there's always risk with any surgical procedure. Obviously, bleeding, infection, which are two typical ones. And we're basically transferring these big muscles of the thigh into the abdomen. And the muscle, in order to survive, has to have a certain blood supply. So we were very fortunate, not only with our total abdominal wall reconstructions that we were doing for people that had multiple failed attempts at reconstructing the belly with normal musculature, that we did not lose any muscles, but I guess that's a relative contraindication or a relative complication where you can lose the muscle doesn't contract. And that would be the downside of the procedure.
Okay.
And when we were dealing with it, obviously, Frank was a young, he really wasn't even a teenager. He was, I guess, an adolescent at the time. And the structures were pretty big. Dr. Fearon was doing these usually at 4 to 5 years of age, when the structures are much smaller, and obviously the complication rate would be much higher.
Yeah. So what qualifies someone for that procedure?
Well, obviously, lack of abdominal wall musculature, whether or not it be acquired by previous surgery or prune belly, it's a hard sell. It's a big operation. There are scars that go from the hip to the knee on both sides, and then scars of the abdomen. And it becomes difficult. Well, I understand you had a couple of kidney transplants, if I recall correctly, right?
Yeah.
They didn't do that through an abdominal incision. They did it through a flank incision on the side?
The first one was through the front. The
Through the front.
second one was through the flank.
Was through the flank. So obviously, if we're going ahead and doing these muscles, if we did this before somebody's renal system was stabilized, they would have to go through our surgery and always run the risk of denervating, taking away the nervous supply to the muscles. So it would be a procedure that I would consider doing in somebody whose renal status was stable. If their renal status is changing, I probably would withhold that procedure at the present time.
All right. And I know you take it from the thigh muscle, but is there any other muscles or places you can take muscle from, or is that the only place we know of as of today that you can do that?
That's a great question. You can take muscles from any place, but there's several criteria that you have to consider, and that is the length of the muscle. It's funny that the distance from the hip to the knee is just about the same as from the hip to the breastbone lengthwise. So we need a very, very long muscle, and we need a muscle that we can move with its nerve supply, so that the muscle just isn't a piece of meat sitting there, because a muscle devoid of neural stimulation is just going to shrink down and become scar tissue. So right now, to the best of my knowledge, I can't think of a muscle being taken from any place else with its nerve supply that's going to be as big in bulk as it's one of the quadricep muscles. It's called the rectus femoris muscle.
All right. So let's get a little bit onto a pre-med track, because I don't know if you've watched some of my videos. I try to incorporate some pre-med content in, so the future of medicine has interest in prune belly a little bit, if that makes sense.
It does.
So what is it like, the day in the life of a plastic surgeon? What does it look like?
Well, I'm a plastic surgeon by specialty. I'm a physician by actually, let me take that back. I'm a physician by training, but a plastic surgeon by specialty.
Okay.
So, whenever anybody asks me what I do for a living, I'm a physician. I'm not a plastic surgeon. Not all plastic surgeons are cosmetic surgeons, and not all cosmetic surgeons are plastic surgeons. So a little caveat to your viewers out there. There are a lot of people that are calling themselves cosmetic surgeons that are not plastic surgeons. And that's terrible, and the public is not aware of that. Well, right now, because I'm basically in the twilight of my career, the gist of my practice has changed. So a plastic surgeon in general works on babies from the day that they're born to adults to the day before they die. And I've operated on a lot of 1 day old. Actually, I've operated on a couple of 1 hour babies, old babies with birth defects. And I've operated on a lot of older people that had not developmental, but acquired defects, bed sores and things like that. So we operate all over the body from birth to death, so to speak. So my practice right now, for the most part, is predominantly cosmetic. I do take on some very, very complicated reconstructive procedures when they find me. I'm still active at Stony Brook University, not to the extent that I had been in the past. So ask me more specific questions. It's hard to speak about yourself.
Okay.
It's very difficult to do that. Remain humble.
All right. So for someone who wants to become a plastic surgeon, what advice would you give them?
Persistence and passion. How's
Okay.
that?
That's amazing.
Think about that, okay? When my son was applying to college, he's a very gifted student. We went to a college fair for the Ivy League schools. And he graduated either 1 or 2 in his class, very bright kid. This is years and years ago. And I went over to the admissions counselor from Princeton University. And living on Long Island, we're all geographically challenged. And I went over to the admissions counselor and I asked her, everybody here in this room has straight A averages. Everybody has A+ averages if you start weighting them. Everybody has spent hours in community service, have 2 or 3 varsity letters, and have belonged to a multitude of clubs. I said, what makes one student or applicant stand out from another? And what are you looking for at Princeton? And she was very tall, very elegant looking woman. And she said 2 words to me. She turned her back and walked away. And I thought, what an arrogant, I'm going to let you fill in the next word. And those 2 words were persistence and passion. And then I gave a lot of thought to it. And those 2 words are brilliant, absolutely brilliant if you start thinking of the implications of those 2 words. I've interviewed for medical school, I've interviewed for general surgical residency training, and I still continue to interview for plastic surgical training. And when I look at applications, you see each personal statement that everybody's making, and I'm sure you did that when you were applying to college, and everyone is a boilerplate of the next. And you know what, if you don't have me at the first sentence, I'm gone. I'm going on to the next thing. If you're looking at letters of recommendation, are you going to get a letter of recommendation from somebody that's not going to give you a good letter of recommendation? Think about it. No, okay? I look at your transcript a little bit, but I really look at the person. And I look at the person and I'm trying to see if they are emanating persistence and passion. So I don't care if they have straight A averages. They can be a solid B student, but since they've been in junior high school, they volunteered at a hospital, for instance, maybe they've gotten involved with some research. If they're lucky, they wrote a paper or two, but you have to exude exuberance. And that's really what I'm looking for. And we're basically interviewing some really talented people for postdoctorate work. They all have dean's letters, and the dean never writes a bad letter. So, and our applications for plastic surgery right now are 70, 80 pages. And when we're interviewing 10 or 12 people for that, you can imagine the amount of reading that we would have to do if we looked at every single thing. So I can take, you know, a student, and it's very difficult to know how somebody's going to perform in the future. And the chairman of our program and I happen to have gone to medical school together, and we've been friends for well over 50 years. And I'm happy to say I've assisted in the training of probably 80 some odd plastic surgeons in my career right now. And it's very difficult to find out who's going to be a good person. We can. There's an old rule. There's an old saying: you can always teach a monkey how to operate. You can't teach a person how to be good. So yeah. It's persistence and passion. Think about that.
Yeah, a lot of the doctors, at least I've personally dealt with, I've loved, have always showed their passion. And I think another thing to that, and I don't know how true it is, but would be compassion as well. Because I think showing compassion and actually listening to the patient shows a lot too.
Yeah, there's compassion and passion. I guess the root origin is basically the same, isn't it?
Yeah.
It's basically the same.
So for someone who's unaware, what is the path to become a plastic surgeon?
I took a very circuitous path road. I applied to medical school during Vietnam. I was not that A+ student. In fact, I was an absolutely terrible student. So I went to college. I could not, Vietnam was going on when I applied to medical school in the early 70s. And I ended up going to school in Brussels in Belgium. So I did 4 years of college. So I bought myself a plane ticket to Belgium because a lot of the docs that I had worked with graduated Belgium, and they were really much better than some of the other foreign schools that Americans were going to back then. So I bought a ticket to Brussels as a waypoint to Rome. And I got to Brussels. I had maybe 50 bucks in my pocket. I had a reservation at a hotel room. I had no place to stay. I didn't speak the language. As a matter of fact, I took French 1 once, French 2 twice, French 3 times, and I absolutely hated French. And I got to Brussels, and I could just about tell the taxi cab driver to take me to the hotel. I got there, I found a place, and I stayed there for 7 years. So medical school's 7 years, at least for me it was, because we had to repeat college there. The European system is you get out of high school and you go straight into medical school. They have some programs now in the United States where there are 6-year programs, combined medical school and college. And then after that, when I trained, they were required to do 5 years of general surgery and then 2 years of plastic surgery. So I had a total, if you think about that, I had a total of 7 years training after medical school and 7 years medical school training. I went on to do a couple of preceptorships in craniofacial surgery. And then I opened up in 1984. So I hate to say it, I'm one of the older plastic surgeons on Long Island, as my wife likes to say, because she doesn't want to be married to an old man. I'm one of the more experienced plastic surgeons. That's what my wife says.
Yeah.
And if you look over my right shoulder over there, that's a statue of one of my residents that did not listen to me.
So, would you do the muscle surgery if a family who was a good candidate for it were to reach out to you, a prune belly family?
I would. I'd like to, obviously, I would like to examine them, find out what the alternatives are. There's some other techniques now for abdominal wall reconstruction that have come out, that I also do. One is called component separation. So I would really have to evaluate them. And it's a procedure that I've not done in a long time, but surgery is like riding a bicycle. Once you've been trained and you know your anatomy, I guess nothing is off limits. In fact, the funny thing was with Dr. Gurr, who was many years my senior, Dr. Gurr was chief of surgery at what's now Winthrop Hospital. It was known as Nassau Hospital, and that's where I met him. And then he became, he was a professor of anatomy at Montefiore Hospital, a very beloved professor. I don't think I've ever met anybody that didn't like this guy. And then he became, in his senior years, he took over at Nassau County Medical Center as chairman in surgery. So when Dr. Gurr retired, I became his attending and took him through a couple of muscle procedures because, what they say about history, if you don't learn from history, you're doomed to repeat it. So I wanted some of my residents to experience having worked with Dr. Gurr because he was a big player in plastic surgery. So it was very funny how it came full circle that he was my mentor and then I subsequently became his mentor later on in life.
Yeah, that's amazing. So now here's something I've heard. A lot of pre-med students major in biology, from what I heard. Would you say that what you major in college matters in terms of whether or not you get accepted to medical school?
I don't know how to answer that. Everybody goes, the medical schools have a certain pre-curriculum requirements to get in. I was a pre-med student and I was a very poor pre-med student. I would never get into medical school today. And I certainly wouldn't get into plastic surgery residency today, especially if I was interviewing myself. Well, maybe I would, maybe because I'd like to think that I show persistence and passion. So you know what? I forgot your question. Just mention it to me again. I got off on a tangent there.
Yeah. What is the success rate of the surgery?
As I said, I've only done 2, and in my hands, 100%. But when somebody says that they haven't had any complications, it means one of 2 things: either they're lying, or they haven't done enough cases. And I always tell this to my patients. I will go over, if I'm doing something for me as simple as a facelift now, or as complicated as a craniofacial case, I will tell people if you go to a doctor and he tells you that he or she doesn't have any complications, they're either lying to you or they haven't done enough.
All right. So today I know about, I think it's 75 to 80% of med students who enter medical school end up changing their mind on what specialty they want to pursue. So my question is, did you always know you wanted to be a plastic surgeon?
The answer is yes, but I didn't know what a plastic surgeon was. So, and I love telling the story because when I was 8 years old, I was playing with a garden rake with a friend, and by accident, one of the tines of the garden rake cut her scalp. And this is the time when doctors made house calls. So the doctor came to, her name was Janet. Doctor came to Janet's house and said that she needed stitches. And as punishment, her mother made me watch while Janet was getting stitches in her scalp. And she was crying hysterically, and I'm sitting in there, and I said, "This is really cool." And I just touched up. I hadn't seen Janet in well over 60 years, and the 2 of us met probably about 8 or 9 years ago. But to take this the next step, we had another playmate of ours who was born with a cleft lip. And she was bullied and she was ostracized because she had a cleft lip. So I always wanted to take care of this type of kid with a cleft lip, but I didn't know it was a plastic surgeon that did that. So as I said, did I always know I wanted to be a plastic surgeon? I guess so, if I knew what a plastic surgeon was. And then what happened is during college, my roommate's father was one of the more famous breast surgeons in the United States. And my roommate found out that I was pre-med and I was looking for a summer job. So I was offered at 18 years old to work in the operating room passing instruments. And I worked at an old hospital called Flower and Fifth Avenue Hospital, which no longer exists. It's right down the block from Mount Sinai Hospital. And Flower and Fifth Avenue Hospital subsequently became New York Medical College. In any event, I was thrown into the operating room there. And I eventually started passing instruments when I was 18 years of age. And I worked there for all the years of my college, in the summers, on holidays and what have you, passing instruments. In fact, the story I always tell, I was dating the plastic surgeon's daughter at the time, and she went to Woodstock. I didn't go to Woodstock because I was on call and she wasn't. So, and I got exposed basically to plastic surgery when I was 18, 19 years of age. I worked a lot with the cosmetic plastic surgeons back then because they really weren't doing a whole lot of reconstructions there. And then when I went back to college, I worked at a hospital called St. Barnabas in New Jersey. And I worked full-time when I was in college. And I got involved with the plastic surgeons that were doing a lot of birth defects. And I'm happy to say that, I spent my entire career, for the most part, taking care of children with very severe birth defects. And prune belly is one of them.
That's absolutely amazing. I'm actually pre-med, by the way.
Are you?
Yeah.
You got a tough course ahead of you.
Yeah, I've heard. So, what are some of the funniest stereotypes that are not true that you've heard about plastic surgery?
It's all tits and ass. How's that? Plastic surgeons have TNA. Ear, nose, and throat doctors have tonsils and adenoids. So we both have TNAs, but on a different level. So plastic surgery is, to me, one of the fascinating specialties. All hand surgeons are all plastic surgeons are hand surgeons. Think about that. Most people think that hand surgery is orthopedics. For most orthopedists to go into hand surgery, they have to take a fellowship. We come out in our training, we're qualified hand surgeons. We're burn surgeons. We run the burn centers at Nassau County Medical Center out here on the island. And I opened the burn center as a co-chair of burn surgery at Stony Brook University. So now we have burn surgery. We have birth defects. We have general reconstruction after car accidents, after cancer procedures, and then of course we have cosmetic surgery as well. So plastic surgery really runs the gamut of everything. Years ago, we used to do a lot of eyelid surgery, oculoplastic surgery. Oculoplastic surgery now has become a specialty in and of itself. I work as an oculoplastic surgeon right now because they don't have a true oculoplastic surgeon, but we were trained in that. So the ophthalmologists are not trained in that today. They have to do a fellowship. We were trained in that. Years ago, hypospadias, where the opening of the urethra is not at the tip of the penis, but rather along the shaft of the penis, was done by plastic surgeons. Now there are specialties in pediatric urology that are now doing the surgery. I was a microsurgeon years ago, and as such, I did the first vasectomy reversal on Long Island years ago. Now there are urologists that are fellowship trained in doing this. So I probably did about 20, 25 vasectomy reversals in my career.
Wow, that's absolutely amazing.
So, I kind of ran the gamut in just about everything.
Yeah, that's absolutely amazing. I definitely wouldn't have expected that.
Yeah. Well, Go ahead. I'm sorry.
Do plastic surgeons, or more important, what I meant to say is, do you do a sex change surgery?
I've started doing now the past 5 or 6 years. I'm doing transgender surgery. It's divided both into top surgery and bottom surgery. I only do the top surgery. So in other words, if in a female to male, we do the mastectomies with reconstruction, and the male to females, we do breast augmentation. I got involved with transgender surgery in 1983 when I was studying in Scotland, and they had a transgender clinic there. And I was blown away by the passion of these people that were really trapped in their bodies. And we were doing a fair number of both top and bottom surgery in Scotland. There was a place called Kenningsburn Hospital. Kenningsburn Hospital has now closed down, but it was the main plastic surgical referral source for England and Scotland. And these people were so passionate about, how they were trapped in their body. And over the past 5 or 6 years, I've gotten involved with the top surgery, and the nicest letters I've ever gotten, thank you letters, have been from these transgender people, because they're trapped, and now all of a sudden they're out there and just living their life.
That's absolutely amazing. Wait, you said you started this in the 80s?
I didn't start it.
Well,
Okay,
not started, but
it was done in
started
Europe.
doing it.
It was done in Europe. I think Christine Jorgensen, if you go to Google and Google her name, was an American who went to, I think it was Sweden or one of the other Scandinavian countries, to have the sex change operation. She came back. There was another one, Renee Richards, and Renee Richards was a professional tennis player, and she also happened to have been an ophthalmologist. And she's a pediatric ophthalmologist, and I believe last I knew she was still practicing in New York. I don't know where she had it done, but these are some of the famous transgender individuals. Obviously, you have Jenner now, who's made it into the news. But these people were really closeted for a very, very long period of time. And it's amazing how you see these people just go out there and live a normal, happy life now.
Yeah. So, what's something that you think would shock most people to find out about plastic surgery?
How hard we work and how long it takes us to become a plastic surgeon. And I like to tell you, I've never worked a day in my life. I'll be very honest with you. I look forward to going to work. My daughter came over to me, and I know I'm going around the question. I'll get back to that in a moment. When she was 9 years old, now she's 36, and she said to me, "I figured out what success is. Success is not making a lot of money; it's living your dream." So I think most plastic surgeons are living their dream. I really think so. And I think I alluded to this before. There are people that go out there and say they're plastic surgeons when they're not plastic surgeons. And I find that terrible, and I find that it's so misleading to the public. So to me, that's probably the most shocking thing. And the other shocking thing that I very frequently see is there are a lot of people that go to foreign countries to have their plastic surgery because it's cheaper. And then when they come back to the United States, if they have a complication, they end up at a hospital and nobody wants to take care of them. Number one is they're not insured. They've had a complication by another surgeon and what have you. It's called medical tourism. I have a couple of my colleagues at big hospitals that they will see 3 to 4 of these patients a week. Now, there's some great doctors wherever you go. And as I told you before, if you don't have a complication, you're not doing enough or you're lying. So, we all have complications. So if you go for medical tourism, and most of them turn out pretty well, but if you have a complication, it's going to end up costing you in the long run. So yeah. I think that's, and we all take care of this. And a lot of plastic surgeons do a lot of pro bono work. Personally, I have done, I think now I'm up to about 28 or 29 international missions. I've operated on every continent with the exception of Antarctica for children with birth defects. I'm the president of our organization out of Colorado. And we're planning our mission to the Philippines in January of 2023 after a hiatus now of 2 years. So I think, we work hard.
Yeah. Going back to that, are pre-meds able to volunteer for that, or is that just for doctors and med students?
We very rarely even take med students.
All right.
We're limited at the number of places that we have in the hospital. We're basically going into a hospital that would not even be considered a hospital by US standards. So we really haven't. I've taken one medical student. He was graduating in about 3 months, and he's been working in plastic surgery probably for the past 3 years.
All right.
And he came with me as a senior medical student, and this kid had unbelievable skills. And he's now, I believe he's in his 4th year now of plastic surgical training. So, but it's rare. That was the first medical student I ever took. I did take my daughter once on a trip, and she was not even involved in medicine, but we were going to Africa, and I wanted my daughter to see what was going on. So I took her. I think she was much more interested in going on safari rather than she was going to the hospital. So it's good to have a father that's a doctor, but you can point, and especially if they're president of the organization. But it's very, very few and far between. We're thinking of creating a scholarship going forward, but we haven't gone in a couple of years. Fundraising has been very hard to come by, and all the doctors pay for themselves and also pay for the supplies and everything that we bring with us.
Wow. So what would you say is the difference between a plastic surgeon and these doctors that are calling themselves cosmetic surgeons?
What differentiates a true plastic surgeon, and there are people that will take exception of what is a true plastic surgeon, but they have what's called the American Board of Surgical Specialties. And the American Board of Surgical Specialties has a specific category for a board certified plastic surgeon. Now, there are other groups, I may even call them licensing groups or what have you, that claim to be board certified, but they're not board certified by the American Board of Plastic Surgery. And that is the only legitimate certification board in true plastic surgery. There's a subspecialty board in oculoplastic surgery right now. There's a subspecialty board in hand surgery right now. There are what's called facial plastic surgeons. Facial plastic surgeons are ear, nose, and throat. Most of whom today have done fellowships, but a lot of whom in the past had never done a fellowship in facial plastic surgery. There are also facial plastic surgeons now that are doing tummy tucks and breast surgery and liposuction when they haven't been trained in that. So I do take, I guess, offense at these people doing it. What else was I going to say? Oh, the other thing that differentiates a true plastic surgeon, and I guess I could say I'm a true plastic surgeon because I paid my dues, so to speak, is anybody in New York State is licensed to practice medicine and surgery in their office. I can go out tomorrow and call myself a neurosurgeon and do neurosurgery in my office, but I can't do it in a hospital. So if somebody is looking for plastic surgery, make sure that that individual is certified to do whatever procedure they're trying to sell you or trying to offer you in a hospital. I do most of my surgery in the office, but I don't do any procedures in my office that I can't do, that I'm not certified to do in a hospital. So for some of you viewers out there, if they are contemplating plastic surgery, make sure they can do that procedure in a hospital. There's a oral surgeon that did a 1-year fellowship. I'm not going to tell you names. I'm not going to tell you the organization that they trained with, who is doing plastic surgery in the office, tummy tucks, breast surgery, everything at all. He did a fellowship. It's usually with 1 or 2 people. And it's not an ACGME, the American College of Graduate Medical Education, approved board. But he's doing surgery in his office. So I guess there's a couple of caveats.
How do people like that even find these, in turn, for lack of a better term, fake fellowships?
Oh, they're out there. It's not a
Okay.
fake fellowship. They have their own independent board, which many years ago basically required a letter and a test, a very small test, to become a member of it. And all of a sudden you were board certified by the American Board of whatever it happens to be.
Oh, okay.
And people could not differentiate between the two boards, what was the legitimate board and what was not the legitimate board.
Okay, that makes sense.
So, yeah, so I think it's being able to perform the procedure in a hospital is really what differentiates a person that's well trained. Well, you know, some of these are well trained. Some of these individuals are well trained. But, you know, somebody once asked me, I do a lot of legal work as well today. And somebody asked me, well, you're board certified, aren't you? I said, yes. Does that make you any better than somebody that's not board certified? And that was a very interesting question. Does it make me better? Probably not. But I know that I've been recognized by my peers.
Yeah. So if you could go back, would you do it all again?
Absolutely. And I would go to a foreign medical school again rather than the United States. I think I got a much better medical education where I went to school than a lot of my colleagues. You know, the more you're in practice, the more everything levels out. But early on, you know, my medical education, I thought was hands above an American medical school education years ago. So did I have an advantage? Yes. Did I have an advantage because when I got into my surgical residency, I knew how to sew, I knew the names of the instruments, I knew how to carry myself in the operating room? The answer is yes. A couple of years later, everything kind of equalized, but I had a little heads up because of persistence.
Yeah.
Think about that.
I'm shocked to hear that it was better at the foreign medical school. And the only reason for that is, isn't there kind of a stigma with certain residencies against foreign medical schools?
Yep. You know, the better medical schools today are not the same medical schools that we had in my era. Where Americans were going years ago is we had medical students going to the Italian schools, chiefly Bologna and Rome. Mexican school, Guadalajara, which was a big one. Brussels, we only had 20 students in my class that went. Guadalajara, on the other hand, had 300 or 400 American students over there. You know, a lot of the other schools, the British schools, Americans maybe got one or two a year into some of the British schools. My classes were all in French, so I had to learn the language. Israel, they have a medical school in Israel that is taught in English as well, but it was only a handful. Now the schools are going to the Caribbean schools right now. Osteopathic schools, which really weren't big back then, are much bigger today than they are. So yeah, there is a stigmata, and it's going to persist. You know, no matter what you do. I can't remember in our training program when the last time was that we took in a foreign grad in the one that I'm currently involved with. Yet two of the senior people in the training program are both foreign grads, myself, as well as the chairman of the department.
Can I ask the reason behind the stigma?
You know, surgery used to be believed to be an old boys club, if you think about it. And when you come from a foreign country, it carries a stigmata. You know, if you and I don't know what it is, and you know, is it a legitimate stigmata? Probably not. Okay, if I had two equal students and one that was exhibiting persistence and passion, and an American student that came in there and was a dullard and what have you, I know who I would choose. You know, so I think that stigmata still exists. You know, why does racism still exist? if you think about it, but it does. What does anti-Semitism still exist? It does. You know, so I don't know. I can't answer that question.
It's one of the things that can't be explained, right?
I think so. I came back. I had to pass a test before I could come into the United States. I passed, you know, as did most of us from Belgium. I don't know if anybody failed from Belgium coming back. Yeah, it's bizarre, and I've never given any much thought to the stigmata question. I've never experienced stigmata in my practice or in my graduate training. I got into a great. I did my 5-year general surgical rotation at Stony Brook, which is a great residency, and I did my plastic surgery at Nassau County Medical Center, which is one of the oldest plastic surgical residencies in the United States, and it's right out here on Long Island.
Yeah, that's amazing. So I think we're getting ready to wrap it up here. Is there any last thoughts?
No, I thank you for inviting me.
All right. I want to thank you very much for coming. It was an honor to have you on.
I enjoyed speaking with you.
All right, everyone, this week's guest, Elliot Duboys. I hope you liked the video. Please like and subscribe. Please share it. And together we can hashtag spread prune belly awareness. And I'll see you next week.
Take care.
You too.
For a long time, I seemed unique from a very early age, asking why, feeling weak, living within a cage, wondering if I am the only one.
What was I supposed to make of my limitations? How much more should I take of this situation? Can it be I am the only one?
The only one. The only one.
All throughout, I found out what love's about. Leaving no doubt, I'll survive. Channel the drive, not deprived. Feel alive.
Do you know how it feels to be different? At times you think you are the only one who exists with the pain of not being the same. When you got brothers and sisters that don't share the same last name or share the same blood, but share the same battle. Some days are real good, some days are just a hassle. Operations to doctor visits, you are not alone. So I wrote this to let you know you don't have to be alone.
The only one.
You don't have to be
The
alone.
only one.
You don't have to be alone.
These days, there are ways through the haze to sing his praise. We gather here with prayers held dear, wanting to erase all pain, death, and fear. Lord, please help them see. No one seems to have heard just how this came to be. We need to spread the word.
Show the world I'm not the only one. No, no. Thank you, Lord. Thank you, Lord, for this community. Thank you, Lord, for the thread we share. Thank you, Lord, for this unity. Thank
devoted to patient support and education of the medical community about this rare condition.
1 in 40,000 live births result in prune belly syndrome, and all of them have all or some of their abdominal muscles missing.
50% will not survive their second birthday.
Our goal is to change the medical profession's perception of prune belly syndrome as a hopeless condition,
and to educate and promote an interest among the community to do further research into the causes of the syndrome
and more effective treatments.
www.prunebelly.org.
You can help.
Thank you, Lord, for this community. Thank you, Lord, for the friends we share. Thank you, Lord, for this unity. Thank you, Lord, for the power of care. Thank you, Lord, for showing me I'm not the only one.
If you don't know what prune belly is, please go to www.prunebelly.org